Welcome back, everyone, to another episode of the Trans and the Mouse podcast, a tongue-in-cheek titled. This, in this episode, we are talking to Helen Webberley all about gender GP, discussing the current state of gender-affirming care, as well as hopefully getting her thoughts on the recent UK Supreme Court ruling, just a little bit. Um, So, yeah, this is episode 70. This will be going out on Monday, 19th of May. So, we may as well get straight into it. So, not that you have to, but do you want to introduce yourself?
Yeah, sure. My name is Dr. Helen Webberley. I'm a UK trained doctor, and I am the founder of GenderGP, which is a service that has kind of grown over the years from a tiny, weeny one-page website 10 years ago to a service now that helps tens of and hundreds of thousands of people across the world to get access to the care that they need. And also, of course, the education and advocacy arm, which is what I'm most heavily involved in these days, trying
Hmm.
to increase the awareness of what it's like to be trans, especially in today's world when it's a little bit tricky.
Yeah, that's putting it like very lightly. Um, yeah, I we had Trey Brown on. It was either last week or the week before. Um, and so the reason why I wanted to have you on is because of your particular expertise in this field, and also because you are obviously at the forefront, as with every other um, organization like Gender GP. So I think because I was doing a little bit of research, and obviously, I mean, if I go to so with Gender GP when it was when it was in its early years, what was the pivotal moment that came to you in as far as what made you start Gender GP in the first place, and what was your main goal?
Yeah, so I was a GP in Wales, and I came across a trans person who needed help, and like many doctors, I didn't know very much about it at all, because we as doctors don't get any training in medical school or after medical school about helping trans people, so it was all brand new to me. And then when I was working with this person, it became really obvious to me that there was very little help for trans people in healthcare. And actually, the help that was available was pretty poor. I was reading lots of stories about how people were being judged and bullied and not treated very nicely, actually within the GP surgery or within the gender clinic themselves. And I was like, well, hang on a minute, that's not how we in the NHS are supposed to treat patients. We're supposed to be nice to patients and give them what they need and help them and encourage them and support them. But the stories that I was reading were awful. And also, I was doing a lot of learning at the time, learning about what it's like to be trans and also what it's like, what healthcare people were asking for because they were trans. And so I put all of my learning on my website that I was making at the time because I quite like tech. And then, so I just made this little website of all my learning. And then before I knew it, people were like, oh, cool, you've got a website and you're a doctor, you can help me. And I was like, okay, I can do that probably. So that's how Gender GP was born, really. Certainly never intended to set out to raise a global organization supporting trans people. But there's such a need for it. That's the thing, isn't it, Torrin? There's such a need
Yeah.
for that service, for help, for access to care. So I think that's what spurred it along, really.
Yeah, absolutely. It's like Susie Green, who we had on. We were lucky enough to have a come on, and she even said something similar to you, what you just said there. There's clearly a need, obviously there's not enough education around trans people to begin with from a GP standpoint. Not to say that all GP not all GPs aren't uneducated in this area. I'm sure there are, but I'm assuming that it's not across the board. And so it's vitally important that mermaids, GenderGP, and other services band together to create. I don't want to say a forum, but
Yeah,
to create an environment where trans people are seen and heard and
yeah,
have the vital care that they need and access. Because we all know that given the current situation with the NHS and the waiting times, which we'll get to in a minute, because I find it very interesting. So I mean, yeah. So obviously, so you started Gender GP 10 years ago. So how does Gender GP and yourselves and your colleagues navigate the challenges of providing care?
yeah. I mean, I think if I was in charge of creating a new access a new service in the NHS, what would it look like? And I think the first thing is that we've got to believe that trans people know themselves best. And so, there's no point putting a trans person in front of a doctor and saying, can you please make a diagnosis of being transgender on this person, please? I mean, that's it. It's ridiculous that we're being asked that we're thinking that that's a sensible thing to do. We don't need doctors and nurses and psychologists and counsellors to diagnose someone as being trans. We've got to start with the self-identification of gender, and skip all of that kind of assessment process. And I think the assessment process should simply be, how best can we help you? What do you need from our healthcare service to support you best? Do you need counselling? Do you need psychotherapy? No? Okay, you're fine. Are you interested in changing your hormones? Do you need some blood tests to monitor your hormones? Is it surgery that you're looking for? Is it just some information and some knowledge that you're looking for? So we've got to stop this kind of diagnosing trans people as being trans, and we've got to allow self-identification. And that would skip a lot of the unnecessary resources that's currently being used in the NHS services. And then I think as well, we need to stop this being a super specialised condition, if you like. I mean, the fact that there's so few gender clinics in the country is because this is a highly specialised service, and it's not. Highly specialised services are for medical conditions which are really, really, really rare. And being transgender is not really, really, really
No.
rare. It's really, really, really common, much more
Yeah.
common than any of us actually know. And we will only see that in the future when it's more permissible to be trans, if you like. So I mean, it just provide this care in the GP surgery, and we need to stop all the assessment and just say. And if someone says, "I want to switch my hormones from an estrogen hormone profile to a testosterone hormone profile," we should just say, "Oh, no problem. I can help you with that." And actually, GPs are really good at hormones. GPs have been doing hormones for years with, contraceptive pills and menopause treatments and fertility treatments and endometriosis and poor sperm counts and all those kind of things. GPs are good at hormones, and they should be just given the confidence to be good at doing trans hormones as well. And then we would have a much better service within the NHS, and we would not have 5 to 10 year waiting lists.
Yeah. That is I wrote down some talking points to make this more as streamlined as possible. But given you mentioned waiting times, I made some notes. Um, the Welsh Gender Service in Cardiff reports a wait time of approximately 20 months for an initial appointment. The Knowing Our Identity Koi Clinic in Belfast has a wait time of 24 months. Now, obviously, I understand that obviously The majority of those, I'm assuming, correct me if I'm wrong, are backlogs. So there are patients that have been waiting for their appointments probably for 2 years or more, and
Yeah.
so they're probably trying to prioritize those. But given obviously, the waiting times, like again, that could be something that could be more streamlined, but I don't know how. But that's not going to be easy to do. So from your standpoint, how would you, if you was in charge of not reshaping gender-affirming care, how would you deal with the waiting times to make it to make it faster, if
Yeah, I
possible?
mean, yeah, well, just like I say, really, you've just got to put this into general practice. There's no point in setting up these special clinics that have got
Mm.
two to 4 year waiting lists, like you say, because even if you set up 10 in Wales tomorrow, it wouldn't cope with the demand. We need to
No.
bring this into general practice. So we need to teach GPs how to very simply and safely switch someone's hormones, which is actually all we're talking about. It's really very easy. You just turn off the testosterone, excuse me, and replace it with estrogen, or you turn off the estrogen and replace it with testosterone. It's really very easy. We just need to teach GPs how to do it, and stop this need for the specialist clinics.
Yeah, yeah. I don't know about you because I don't know how often, obviously, because I don't know how often you use social media, but I've seen a lot, especially within, I want to say, the last 3 weeks. Especially, I've seen this myth go around saying, "Oh, it's like GPs are handing out prescriptions." Like as if it's like in a candy store, and it's like that's just not simply correct. Like like I deal with mental health, right? And I'm sure, trans people do as well in many forms, right? It takes it for me to get a prescription, it takes me probably 2 weeks for that to go through. Because, you know, for a trans person to go into want to have, I don't know, prescriptions for estrogen or whatever it may be for them, GPs don't dole them out like their Tic Tacs. No, there's a process. So I keep seeing this myth go around, especially typically it comes from turfs, but it's like that's just not how it works. And so
No.
that's not exactly helping either, because it's making it more confusing. It's making GP's job harder. Like you're saying, they're not actually dealing with the patient, asking them what they want. It's more of the case of you have this, so we're going to give you this, even though it's not what you want. We're going to give it you anyway.
Yeah, I certainly don't think GPs are handing out gender-affirming
No.
hormones like Smarties. I think that would be
Yeah.
that would be a good day if they were.
Yeah.
Because I tell you what, I mean, a trans person would only take the opposite hormone, if you like, if
Yeah.
they wanted to achieve masculinization or feminization or somewhere in between. So even if we did hand it to everybody, just in case you are trans, just in case you want to switch your hormones, it's only the trans people that are going to want to do it, or the people who wish to just feminize their body a bit or masculinize their body a bit. It's just really not a problem. But I do not think for a minute that GPs are handing out hormones like Smarties. Just no.
Yeah. To switch tact for a little
Hmm.
bit. I recently watched your interview, some of your
Hmm.
interviews on GB News,
Hmm.
where which I I admire you for going on there, especially in that environment because but yeah, it's like, and I think to go into that environment and stick to your guns like you did, it's not only amazing but also what we all have our reasons for doing what we do and going on certain programs. But what made you go on there, even though you probably knew that they weren't going to maybe listen to what you were actually saying?
Well, I think, there's a lot of misinformation and lies,
Yeah.
isn't there, going on at the moment? There's a lot of hate speech. There's a lot of untruths. There's a lot of, panic and fear. People spouting all kinds of rubbish. And, either we just let that become the truth, because people are listening to these programs. People are listening to this rubbish. Or some of us have to go on there and say, actually, that's not the truth, and this is the real truth. And so, and if it's kind of like, if we allow these people to be unfettered and just say whatever they want to say and do whatever they want to do, then they're going to kind of win, and we don't want that, do we? We want the truth
No.
to go out there. So I don't have a problem. I mean, in fact, it's the easiest job in the world for me, because I know what the truth is, because I was taught it by thousands of trans people. I know what
Yeah.
the truth is, and it's very easy. So when someone starts spouting at me that you can't change sex from a boy to a girl, I'm like, really? Why are you feeding me such easy questions? Do you know what I mean? So
Yeah.
someone's got to do it, and I'm very happy to go there and just clear up all that misinformation, and yeah, and state the truth, really.
Yeah, that's why I also admire Frida Wallace as well. Even though she gets a lot of hate for doing it,
Mm,
she essentially does the same thing. Because she she says that she's the only trans voice in the media. Um, I'd slightly tag on India Willoughby there, but yeah, I mean, Frida Wallace gets hated for doing what she does, but she does exactly the same thing, and she puts it back, and that's what
yeah,
we need now. Not
yeah,
everyone needs to go on a platform like you, Frida Wallace or India Willoughby, to push back on misinformation, but it helps.
yeah, for sure.
Um, because I mean, this. I mentioned this to Jay Brown because I think this is also partly part of the problem as well when turfs, misgender the wrong people. Because that's again stoking fear, misinformation, because trans investigations. Because I've numerous times. I think it got to about 30 plus times I've been misgendered for a woman by turfs, and it's like that's not helping. It's not helping trans people, and it's because trans people, as you've said, and as I've said, and my co-host who happens to be trans as well, trans, right? We have always said, listen to trans people. We know we are trans.
Yeah,
We just want that access. The same care that cis people receive, cis kids can still access puberty blockers.
yeah,
Why can't trans kids? Oh no,
yeah,
they like, but yeah, so yeah, just keep going into the lion's den because needs must. Otherwise, we could be facing a real problem in the future
yeah,
if kids
yeah,
can't access the vital care that they need. Um, anyway, so going on to the next talking point. So I think we already kind of know the answer to this question given the current climate. But what are the biggest barriers in trans people face today when seeking gender-affirming care? We probably already answered this, but what is the global impact as well that we're
yeah.
seeing?
I think it's really tragic, isn't it? Because,
Yeah,
like you say, trans people just want to just have the best healthy
yeah,
lives possible. That's all. That's all that anybody asks for, whether you're trans or cis or whatever. It doesn't matter. We just want to live the longest, healthiest, happiest lives. And why just because someone is trans do they find it difficult to access healthcare? And that's terrible. And I think what's really sad is that it doesn't matter whether you're accessing healthcare for a broken elbow or for a bad knee or for a bad tummy, or whether you do want to have some gender, changing medications and some support with hormones or puberty blockers or surgery. It seems it doesn't matter what you're going to see the doctor for. You get a raw deal as soon as it kind of surfaces that you're trans, and that's just an absolutely terrible thing. And we used to have it with black people, for example. In
mm,
the olden days, black people didn't get the greatest care.
no,
In the olden days, gay people were judged in the doctor's surgery, and so today we have trans people being judged. But just because it happened before doesn't mean it's acceptable today. And
exactly.
we should be learning from our mistakes and not just carrying them on again and again. But it all comes from a lack of education, a lack of knowledge. And I admire trans people who are brave enough to kind of stand up and say, look at me, I am trans, nothing to worry about here, nothing odd, nothing to be scared of. I'm not going to hurt you. I'm not going to steal your children or whatever. I'm just
Yeah,
a normal kind of guy, just wanting to live my life, same as you are, kind of thing. And that's what we need. We need cis people who are terrified of trans people at the moment, just to see trans people and go, oh, okay, well, that wasn't very exciting. That was
no,
just normal. That was just normal, and as soon as we get that, we'll stop. But at the moment, I think trans people have had to hide away, and so there's all that fear, and oh my goodness, what is it like? And they're trying to steal my space, and it's like, no, they're not trying to steal your space. They're just trying to live a happy life.
yeah, it's like we've already seen, we'll get to this later, obviously, but just to bring it up, given the recent UK Supreme Court ruling, we've already seen there's already been two cases, if I'm not mistaken, of a lesbian cis woman being escorted out of the changing room because a security guard thought she was a man. And we've also had another one. I think it was in the US. Don't I might be wrong. I might be. Oh, please correct me. Yeah. So there's only been two instances of a lesbian and I'm assuming a cis woman who has been escorted out of the changing room and then had to be escorted back in by her friends to use the changing room. And this is already happening. So this is already backfired. But I mean, going back to the education part, I've always said this, and it's like, history is history for a reason. You know, all of this, mass media attention, mass media attack on trans people, you only have to go back like probably 100 years or more, and you look at black people and you look at segregation, they can only go into certain areas, right? You don't have to take that, obviously, just put aside black people, right, and just replace the black people with trans people, and you can see the exact same things happening.
Yeah, yeah,
And it's like, no, right, trans people, like you said, they're not going after your kids. They're not the ones, abusing women. They're not the ones causing all of this chaos. They just want to live their life, right, peacefully, right, just like anyone else. But no, because you have associated, the PDF file, term to trans people, right? You have now created an environment to where trans people are literally and figuratively fearing for their lives as though they
yeah,
should.
yeah,
Again, look back in history. Look at what happened in America. They fought the overturning of Roe v. Wade. You know, women's
yeah,
rights. It's like this isn't all made up. This is real life, right? And women, cis women, are already being targeted, right? And so, what's going to happen? I don't know. But as I say, I will hopefully, if you don't mind, get your thoughts on that later on. But yeah, I mean, history is history. It's not, you don't have to be rocket science to work this out, but apparently you do, according to turfs. But anyway, so I think we've already talked about this, but what has the public discourse around gender identity in recent years impacted the availability and perception of care for trans individuals? Is there anything more you want to add to that?
Yeah, I
Perception?
think we have you call them TERFs, whatever we want to call them, but we have
Yeah.
people who are scared of trans people. We have people who
Hmm.
don't understand trans people, and we have those people who want to cause harm
Yeah.
or withdraw services and rights and privileges of trans people. It's just I can't believe I'm saying these words
Yeah.
in this lifetime, but you know that it's true. And the trouble is, we do have those people out in the street, out down on your high street, in your local shops, in your local pubs. But also, it seems to me, we have these people in high places too. And if we have them in our politicians or in our policymakers or high up in schools or hospitals, important doctors or important politicians, important educators, then we're in real trouble. And I think that's what we've seen happening. We've got some I'll call them anti-trans people
Yeah.
in high up places, and that hurts. That all of a sudden starts meaning that some of our policies and laws and guidelines are going to be not supportive of trans people's rights, and that's atrocious. But it's happening, and so I think we've got a little way to go in reversing some of that. But for sure, we've got to work hard at it before
Oh
it
yeah,
gets any
absolutely.
worse.
Yeah, because I mean, you bring up politicians, you've got Rez Streeting, who was a gay man himself. Um, you've got Kemi Badenoch. You obviously we had the cash report, the now debunked cash report. We recently had the Sullivan report, which I haven't looked into, but I'm assuming it's going to be the same as the cash report. But yeah, we need to start pushing back, and it's you know, and what is amazing, and what was an amazing response was, I think, either on the same day or the day after, 25,000 in London, 25,000 people turned up to protest.
Yeah.
That is
Yeah.
an, that is that there is an amazing turnout in a short amount of time.
Yeah, I thought that was absolutely brilliant. Absolutely.
Yeah,
And it shows that, kind of in the background, there are so many people who do support trans rights. And just want a world that's inclusive and welcoming to everybody. Every single person in the world has an equal right to live and be happy and be loved. And it shows that there's lots of people out there who do think this way, but there's a few people who've got very big mouths who think the opposite. And what we've actually got to do is just start putting sticky tape over their mouths and say, "Shush! Your views. Keep your views at home. Go into the bathroom
yeah,
mirror and talk to the bathroom mirror that one because your view is not welcome here. That's not
no,
a nice thing to say."
exactly. It's like it reminds me of a Rosa Parks moment. That everyone rose up, is why
Mm,
it started to rise up, get behind an important movement, and it's like, look what can happen. Like,
yeah,
five women, right, versus 25,000 people who turned up. I think it was within less than half an hour that 25,000 people en masse turned up to protest, and it's like, what image do you want to run with? Five people drinking champagne thinking that they won something which I haven't because it wasn't really a win.
no,
And I'd want to go with the en masse 25,000 people turn up in full force saying no. I'd want
yeah,
to go with that. But
totally agree.
unfortunately, because media is media, they're going to go with that. But yeah,
Yeah,
I thought it was amazing. We recently had a protest in Nottingham against transphobia. They drowned out I like to call her the bargain basement Marilyn Monroe. Rosie Parker, Rosie
Mm.
Parker, whatever her name is. So yeah, that's going to. I can foresee that continuing to happen throughout the year into next year. Because but obviously we have to wait and see what's happening in the US with trans people over there to see where
Yeah.
we stand.
Yeah.
But yeah, an amazing turnout, and yeah, I hope to see it continue. So yeah, that's the perception. Now, the policy and legislation. So how do you see policies like the Equality Act? I mean, I think we've already touched on this in a roundabout way, supporting or hindering access to gender-affirming care or any other services around gender-affirming care.
Yeah, I mean, I think the Equality Act, obviously there are 9 protected characteristics,
Hmm.
and the confusion on there is that sex is on there, and also gender reassignment is on there. And so we've got women saying, people who are assigned female at birth, women saying, I demand protection because I'm a woman. And then we've got trans women saying, well, I also demand protection because I'm a woman, and also I demand protection because I've undergone gender reassignment, and those
Yeah,
two things are both protected. But there's confusion, and that's why people are saying, no, you can't change your sex. And but people are like, I'm not changing my sex, I'm changing my gender. And they're like, oh, that means you're a man then. It's like, oh my goodness. So we just need
yeah,
to clear it up. But actually, do you know what? Sometimes people will just interpret policy or law or a document the way that they want to interpret it. And that's what happened with the Supreme Court, didn't it?
yeah.
People interpreted it the way that they wanted to interpret it. And as you quite rightly said, it was not a win for those revolting women drinking champagne
No.
outside on the steps. It was not a win. I hope that they're in the future, when they look back on that, they're totally ashamed of themselves standing there like that. And anyone who's printed up a T-shirt with them on it and should also be equally ashamed of themselves. The disgusting behaviour. But it's just how we as educated common members of the population who just interpret these things properly. And what we're actually saying with the Equality Act is, can everyone just get on with each other, please? And can you just make sure that if that person's struggling a bit, that you move over and let them through? And that's all we're saying. Just treat people equally. That's all anybody wants. And that's what the law says. Treat everybody the same. Include everybody in everything that you are offering or do.
Yeah, it's like I don't. It's like anyone who listens to this, um, if you know this, please correct me, Helen. But I mean, I brought this up again. I brought this up when I was interviewing Che Brown, April Ashley, uh, the 1970 Corbett v. Corbett, where the judge, um, looked at, the paper, and he said to the people who drew it up to write it again in favor of him. And if those of you who don't know, April Ashley was and is a trans woman who sadly, passed away some time ago now. Again, correct me if I'm wrong, but I think that was a precursor to the 2004 being enacted, but I could be wrong. But it's like, again, trans people have existed for decades, right? It's like, and they have happily gone through their life, everyday life, without a problem in the world. I'm sure they've, uh, you know, had hate towards them, but but it's probably very minor. I'm assuming. And you rightly brought up, gay people, you know, growing up in Section 28, you know, all the gay slurs, the PDF files and all of that groomer, you know, all of this is regurgitated. And the UK Supreme Court ruling, which so happens not to have included a trans person or a trans organization, funnily enough, or cis women, or in the case of LGBT Alliance, some gay women who are against their own community. It's like, no, what you're going to see, and I predict this, and you're going to see a mass wave of cis people, trans allies, trans people all band together and say a massive fuck you to everyone who opposes trans people, or because you are bothered about what genitalia they have or don't have, right, or vice versa. No, we're gonna see a massive uprising, and I'm not, and I've said it before, you know, I'm a cis man who have been, I'm a cis man. My co-host is a woman, or she's trans, but she's a woman because she's a woman. Right, I am not the voice in this. I'm just an ally. Right, so don't listen to me. Listen to trans people. Listen to people like Helen Webberley who speak to trans people on a daily basis. I'm assuming she works with them. Same with Susie Green. Listen to the people who are doing the work. You know,
Absolutely.
I'm just a voice who happens to co-host a podcast with a trans person and we've been doing this for almost 2 years. It will be 2 years in October, right? Who I call a friend. I have another friend who recently started her transition. I think 6 months to maybe a year ago. She completely ignores everything. She barely uses social media. She doesn't listen to the news, or if she does, she just highlights what she wants to say. She lives her life. That's it. That's all. But that's all trans people want to do: live their life. How it's like, how would a cis woman like it if was someone wanted to invade their privacy?
Yeah.
They wouldn't like it. So why do they do trans people? Oh, I know why.
Yeah.
Because they don't see trans people as human.
Yeah. No,
So
I think you're right, and I think I think there are lots of cis allies who are standing up for trans people, and I think that's whether that's just in people's homes. It's like when they hear Auntie Jan blathering on about it again, they're like, Auntie, that's not
yeah,
very nice. We don't talk about people like that. And in schools, we need to start saying, no, children, that's not, no, that's not how we behave here. And I think online as well, we need people to start saying, actually, that's not very kind. We don't have to shout or swear or scream. We just have to go, actually, that's not very acceptable. And that behavior,
no,
I'm not going to talk to you, follow you, engage with you. I don't
yeah,
want to be your friend if you're going to think like that about another human being. So I think there are lots and lots and lots of allies. Whether they've got as big a voices at the moment as some of those meanies out there, I don't think they have. But that doesn't mean they're not there, does it? There's a
no,
lot of
exactly.
support.
Yeah, it's like and I also see a lot of I'm not gonna say turf because
No.
because I don't know what the hell they go by anymore. I'll just say like you, I'll just say anti-trans people espouse primary school level biology because they don't seem to understand the because they don't seem to understand that biology is ever evolving. We understand more every day. It's kind of like science. It evolves. We learn more. What we knew 10 years ago has evolved. What we
Yeah.
knew yesterday has evolved. That's how
Yeah.
biology works. But they can't grasp that. So they regurgitate a script, if you like, that, oh, humans can't change sex. Well, they can, and they've
Yeah.
done so throughout history. But so yeah, listen to trans people, listen to trans voices who know what they're talking about. They know who they are, and also with with the going back to the self ID thing, like when self ID first rolled out, um, did you have, from your point of view, did you have any concerns with it at all? I.e., did you think that there were going to be any loopholes?
I don't think. Well, I don't see why you would be anyone would be concerned about it at all. Like, what's the problem? If someone, you know, says, actually, I'm not he, I'm she. I'm not a girl, I'm a boy. I'm not. It's like I don't know what advantage people think that that gives somebody. You know, we stopped saying that men were better than women or women were better than men years ago. So why ever are we saying that, you know, people would get an advantage by being or pretending to be a man or a woman? It's like, grow up. You know, we're living in 2025 now.
Yeah,
And actually, being trans isn't not it's tricky at the moment. It's tricky. So why would someone want to pretend to be trans? You know,
yeah,
is it to be cool? If you want to be cool, you do whatever you want to do to your hair or you know, your
yeah,
clothes, your makeup. You want to be cool, but I just think it's ridiculous, and we need to, and cis people need to stop worrying that if we give trans people the ability to say this is my gender, then that's something that the world is going to fall apart. It's not. It's fine. Just let people be themselves.
yeah. It's like the reason, it's like, you know, I agree with you. It's like the reason why I asked that question is because, you know, when the self ID came into fruition, almost immediately there was a photo going around of Adam Graham, aka Ida Bryson, who I read an article where someone interviewed his wife,
Mm.
well, ex-wife, and she said that he had absolutely no interest whatsoever in transitioning, not one. And it's like, you know, I saw an image in the newspaper. I don't read it. I saw it online of a headline saying self ID and a photo of Adam Graham, a double rapist, mind you, in a wig, right? And you know, all because, you know, self ID was the tagline. And it's like, are you are you seriously? This is what I think to myself in my head. Are these people really that stupid? But it's like a but it's like a moth to a flame. When they see a headline, they run with it. They don't fact check it. They don't say, "Oh, is that true?" No, they run with it. But yeah, it's like self ID has a place, right? It's primarily self ID is primarily for trans people and other people who want to say, "Listen, I am who I am. My gender is this. I am she. I'm he. Whatever. Let me live my
Yeah,
life."
exactly. I couldn't agree more with you.
So, you know, it's like on last week's pod episode, I kind of went on because I think me and my co-host Max was reacting to something. Oh yeah, we was reacting to a GB News segment with Posey Parker and Graham Linehan, who obviously just had his day in court. Um, and I sort of went off on one. So I went on my soapbox. Um, but yeah, anyway, so let me quickly. So where was I? So, uh, do you feel governments and healthcare providers are keeping pace with the needs of the trans community? I think we've already briefly briefly spoke about this, but is there anything that you want to add to that?
Well, it's interesting that you mentioned that because I think today in the news, which I'm going to have to go in about 5 minutes because
Yeah, that's fine.
I'm going on your favourite GB News
Oh, yeah,
this lunchtime to talk about that because, you know, the NHS have talked about, you know, services for children for some time, and you know, now there's an outcry that they're going to be providing support for young trans children, as if, you know, as if that's a terrible thing to do. And I'm like, why? Why is it a terrible thing to do to provide support, education, advice, care for anybody of any age? I just don't. I just it's just so hard to believe that people are talking about it like that.
Yeah, absolutely. Yeah. So also because you have to go in 5 minutes time, which is absolutely fine because I understand. Let me ask you one more
Okay, no
question and then
problems.
I'll let you get off. So how can public attitudes and misconceptions about gender affirming care be better addressed?
I think what we need to do, Taryn, is what we need to be doing is educating and informing people, and things like this podcast, which will be listened to by people to help them understand what it's like to be trans. Things like trans positive people going on the news, trans positive people showing up at protests and what have you. I think that visibility and just showing that trans people are just ordinary folk, nothing to worry about, nothing to see here, just people going about their day. And that's, so once we've got that visibility, I think the fear will go away. And then people will be like, actually, there isn't anything to worry about here. Let's all play together nicely, shall we? And I think that's what we need, isn't it, really? But what
Yeah,
we've got a little bit of we've got misinformation at the moment, and we need to clear that up with good information. So honesty and truth and real life stories, and people showing themselves and just saying, even on TikTok, people showing themselves and just saying, this is me. I'm trans. Would you think I should go in a boys' toilet? Of course I shouldn't. Look at me, kind of thing, And I think, it all helps, doesn't it? Anyone who's kind of putting themselves up to just show people what being trans is all about.
absolutely. I couldn't agree more. And I will obviously I will put all the relevant links down below to GenderGP, um, social media and all of that. So yeah, I hope that if anyone listens to this, which I hope you do, go follow Helen Webberley on Twitter, and all of that, and listen to trans people. You know, listen if you want, and if you want someone to listen to, watch, go to Jamie Dodger, Jamie Rings. He's a trans man. He has a YouTube where he dispels misinformation. Go listen to him. There's Katie Montgomery, who's another one, Frida Wallace. Right, there are trans people out there. You just got to go and find them. And so, yeah, I will put all the links down below. I thank Helen Webberley for giving us her time. I thoroughly enjoyed this conversation. And yeah, this will be going out on Monday, 19th of May. So be sure to be on the lookout for that. See you in the next one. Right, let me end this. So